Hi and welcome back to our asthma webinar series, and this is week 2. In week 1 we gave a brief overview of asthma. We discussed that asthma is a long-term condition which causes occasional difficulty in breathing. Some people require treatments such as inhalers, some people might require tablets or other kinds of medications. It's a reversible condition. It's caused by narrowing of the airways which cause the difficulty in breathing symptoms. We briefly touched on various triggers, so that might include mold, spores, cold air, exercise, infections and a few other triggers. Usually asthma causes a wheezing symptom, which is like a whistling noise, tightness in the chest, and it might cause coughing as well. So asthma is a very serious condition, which is why we're taking it so seriously as well. It kills about 3 people in the UK each day, but also causes potentially life-threatening asthma exacerbations and many more. Okay, last time we had Vin 2. I did my best to try and invite Vin 2 back. Unfortunately, he was unavailable today. Syra, the practice manager, is also unavailable, but I did an audition and we auditioned plenty of people. Anyway, we gave it a go with Vin 3, who just flew over from Spain, but I'm not convinced. Hola, señoritas. I don't think this is going to work. Sorry. Okay, moving on. Is asthma easy to diagnose? The simple answer is no, it's not. Sometimes the diagnosis can be quite confusing. How does a GP actually diagnose it? So if you've been experiencing the symptoms of asthma, the ones we discussed earlier, so the GP is going to ask you what the symptoms are you've been experiencing, the history around that, so whether it occurs at any particular time of day, for example in the morning or in the evening. They'll talk about the triggers, so if you're experiencing worsening symptoms when there's cold air or when you're near mold spores, exercising as well, or smoke, even if you've had exacerbations when you've been exposed to viral infections. So in children, asthma might be triggered even by emotions and laughter, so that's an interesting one to look out for. In adults, certain medications might trigger, so if you've had a bad back and you've taken ibuprofen but you notice your breathing gets worse, so that might be a sign of asthma or a wheeze exacerbated by ibuprofen. So if my video editing skills are working, there will be a magical peak flow appearing in front of me. I hope that works, otherwise it's going to look really weird. So a peak flow is a device that you blow into, and we'll be teaching the technique. Usually you stand up and you take a deep breath in and you purse your lips around the mouthpiece of the peak flow and you blow out forcefully and as fast as possible as well. And it measures the amount of puff you have in your lungs. So this gives you a peak flow value. And we know that in asthmatics, usually, so you have your best peak flow, which is when you're doing very well, and then if your asthma is not very good, your peak flow will drop. So this helps to monitor your asthma, but also it helps with the diagnosis as well. If we're unsure, we can look at the trends of the peak flow and whether it's changing based on the time of day and your exposures during the day as well. It's a really useful test, and even if you already know you have asthma, it helps with monitoring, and it can give you almost a warning light sign that you're about to have an asthma exacerbation, or today maybe the asthma is not very well controlled. So that is the first type of test. Remember, you can actually buy these peak flows yourself from pharmacies, even online as well. So moving on from the peak flow, the next type of test I wanted to introduce is called a spirometry. Spirometry, similar to the peak flow, but you actually have a continuous blowing action into the machine, and it actually gives you a recording of the amount of puff you have in your lungs across a time period. So this is really useful, especially if we're not quite sure if it's asthma or if it's some other kind of lung condition which is causing your breathing symptoms. One useful thing about this test is that you can actually do a test before you take your inhaler. So usually you bring along your blue inhaler on the day of the test, or whichever inhaler you're using regularly. They do a test before you use the machine, and they do a test after you use the machine. This shows whether you've got reversibility, i.e. if your breathing improves using the inhaler, then it shows that you have a reversible lung condition, and it might be asthma. So this machine is not usually available to the consumer, so you can't usually just buy it and use it at home. It's actually either going to be at the GP surgery, or the GP will be referring you to a service where they'll do this for you, and they'll write a report and send it back to your GP. So the third type of test that you might be referred to a specialist clinic for, if we're not sure whether this is asthma, is called an FeNO test. Now this is an interesting test that measures the amount of nitric oxide in your breath. Nitric oxide is usually produced in response to inflammation or swelling within the lungs, and that might be a sign that you've got asthma. So if it's a child, and usually children are very difficult to diagnose for asthma, especially before the age of 5, the doctor will firstly use their clinical judgment based on the signs, symptoms, triggers, and the likelihood of asthma. If it's not very clear, then they will be referring further to the test that I've explained previously. Now, I hope you enjoyed this webinar. So just to summarize, that an asthma diagnosis is not always very easy. Sometimes we have to rely further, and we can't just diagnose it based on history and trigger symptoms. Sometimes we've got to refer on for further investigations, whether we ask the patient to keep a peak flow diary, or whether we send them for a spirometry or FeNO testing when we're unsure. Anyway, I look forward to bringing you back for next week's webinar. Until then, bye for now.